For a few years on the WHONET website, we have had the WHONET training course, and I will show that website to you. But we have not had a formal backlink training course, and we are in the process of releasing that. We do have many backlink tutorials and guidelines and training materials, but we have not had YouTube-based, self-paced training, so we are in the process of getting those ready for release. So, and Adam, from your side, we're ready to continue? No other comments or?
Yep, go ahead, John.
Great, thank you. So the backlink training course has 6 modules. Number 1, Introduction to Backlink, and I will cover a portion of that module today, followed by a live demo. And then I will talk about all of these other steps today, but there will be modules dedicated to them. How do you create a local data file? How do you run backlink configuration? Part 1, for the basic core, most important things: organism, date, identifiers, antibiotic results. And how do we convert data? And then backlink configuration part 2. You might have information like treatment and province and molecular type that are valuable. They are not core, but they are valuable. So we will do that in the second pass, backlink configuration part 2. I guess one could describe it as some of the more advanced features that many of you will not need, but some of you will need. Once you finish with backlink, then you can get started with WHONET. I hope there's a lot of background noise for me. They're doing street construction. I hope that's not interfering with the sound quality. So module 1 has 3 sections, A, B, and C. What is backlink? And that's what I will do now with the PowerPoint. And then how do you download and install WHONET? We'll do that, WHONET and backlink. We'll talk about that very quickly. And the backlink main screen. So using PowerPoint, I will do A, and then with a live demo, I will do B and C. So what is backlink? Well, to know what backlink is, first you know what WHONET is. WHONET is a widely used free software developed for the management and analysis of microbiology laboratory data to support local, national, regional, and global activities to understand and fight infectious diseases with a special focus on antimicrobial resistance. WHONET is a desktop application developed for Microsoft Windows. Many people do run WHONET very well on Macintosh computers, either with a Windows partition, a virtual machine, or an emulation software. If you would like further information on that, please, we have information, I believe, on the website, or just send us an email and let us know. So that's what a WHONET is. So where does backlink come in? Laboratory data management systems. Many laboratories in the world use paper notebooks. They do not have an IT system. They don't have a database. Everything goes in notebooks and medical records on paper to go back to the clinicians. For the laboratories I just described, you do not need backlink. You need WHONET. So you use WHONET for data entry, data analysis, clinical reporting, and you do not need backlink because there is no local IT system. However, many laboratories, I think most laboratories in the world, do have some kind of data system in place. Some of them are very simple. Excel, Microsoft Access. This is especially common in low resource settings where someone in the lab or someone in the country makes an Excel template for data entry. It is also common to use Excel in high resource countries if they have a special project. If they have a research project, a protocol, something for a few months, something that their lab information system cannot handle, it is also common that people will put their data into Excel. So that's one kind of lab system, very basic. Secondly, many of you have laboratory instruments, such as a Vitek, a Phoenix, a MicroScan, a Sensititer. There are also camera systems like SERScan and Biomic that can read zone diameters and do reporting. So these are laboratory machines. And they're very standardized. There's one Vitek 2 machine in the world. Then they have Vitek Mila, they have a few different softwares. Phoenix, MicroScan, all over the world, the Vitek machines are very similar. Sensitide or MicroScan with the same software, or maybe a couple of versions of their software. So usually the machines are very easy to work with because they are so well standardized around the world. They only come from a few vendors. Finally, many labs in the world do have a lab information system. I will abbreviate that often to LIS, Lab Information System. Other places in the world often call it a LIMS system, Lab Information Management System. Some people think there are small differences, but from my perspective, the way that I use it, I will talk about LIS or LIMS in the same way. So a lab information system is for day-to-day operations, workflow, clinical reporting, medical archives, possibly billing. And these can be made by the institution locally. They can be a national LIS or an international LIS. Some are free, some are commercial. Of course, when I say free, free doesn't mean free. You still have to buy servers and maybe training and connections. So the software and the general concept might be free, but of course, free, there are costs involved in implementation and operation. Many of the free ones are made by public health oriented organizations, and I will mention some of them. Some of these LISs only cover microbiology data. Most of them, however, also do blood bank, hematology, chemistry. One thing I have found is that many of them do not do microbiology very well, and some of you may have had that same experience. Many times they start with blood bank, hematology, chemistry. They make a nice LIS, but in microbiology, they cut corners and make it too simple. Especially this is problematic with regard to antimicrobial susceptibility test results, which can be complicated to do the interpretations of MIC values and zone diameters. So in summary, some of you don't have a computer system at all. You have paper notebooks. You really don't need this webinar now. You might need it in the future. It might be interesting for you to listen. But if you have no lab computer system, you don't need BacLink, you need WHONET. But if you do have some kind of IT system, simple, medium, advanced, then that's where BacLink is very valuable. So who should learn BacLink? Well, if your laboratory does not have computer records, you do not need BacLink. You can just put your data into WHONET directly. If your laboratory has a data management system, then BacLink should be a very valuable software. It can avoid double. We want you to enter the data into your computer system. We do not want you to re-enter manually the same data into WHONET. It's a waste of time. There's the risk of mistakes. You are all very busy people. Of course, you have to enter the data into your system. We don't want you to re-enter the same data into WHONET manually, and that's where BacLink comes in. So if you have an IT system in your organization, that doesn't mean everybody needs to learn BacLink. The people who would learn BacLink are the data managers. The data managers are often in the laboratory, sometimes the infection control team, sometimes the IT staff. It depends on how you divide the work in your facility. For clinicians, pharmacists, policymakers, many of you will certainly benefit from learning WHONET for analysis, interpretation, public health reporting. So when I go to a facility like a hospital, I try to teach BacLink to 2 or 3 people responsible for data collection. I try to teach WHONET to maybe 10, 20, 30 people who might be involved in the analysis of that data. So if the clinicians and pharmacists are not directly involved in the capture of data, then they don't need to learn BacLink. It's the lab staff or the IT staff or maybe infection control staff. They're the people who prepare the data files. Once the data files are prepared, then you can go ahead and many people can use WHONET. So what is the purpose of BacLink? As mentioned, the situation is that laboratories around the world have diverse systems that serve important functions for day-to-day laboratory, clinical, medical archives, and billing purposes. These systems are incompatible. They might work very well locally, but they can't easily share their data with their national and international colleagues. Most lab systems do not have very sophisticated analysis or public health reporting. In my hospital, we use SunQuest. SunQuest does not do WHO GLASS reporting. SunQuest does not do FAO reporting. So these are very valuable systems with certain valuable purposes. And if we can get the data to backlink, then they can benefit from the analytical tools that WHONET offers. So it's an obstacle. Each of these systems are incompatible. Different languages, different codes, different degrees of sophistication, but it's an opportunity. Somebody has taken the time and effort to computerize the laboratory results on a daily basis. If we can extract these data into compatible systems, we can have the basis of a low-cost, sustainable, real-time system for local, national, regional, global surveillance, alerts, and action. So there's a wonderful resource in your labs. How can we tap into it for purposes of understanding? So the purpose of backlink is transforming data from existing information systems into standardized WHONET files for analysis, sharing, and public health reporting. On the left, you might see incompatible systems in Vitek and Sensititer and Phoenix. And on the right, they all become standardized WHONET files that are compatible, that can be shared. And that's because of the backlink software. Do you have to use backlink? Well, when you use backlink, there are basically two steps. Step one, you export the data from the lab system. And step two, you import the data using backlink. There is another approach using a single step, but we don't usually recommend it. If an IT developer asks us for the structure of a WHONET data file, we can give them the specifications and they can make a WHONET file themselves. But that requires a lot of work on their on their side. They often do not get all the details correct. They may cut corners. They may make big mistakes. They might make small mistakes. So if they want to make a WHONET file directly, technically they can, but it is a lot of work. And it's not only the data structure, it's the codes. And over time, there are new organisms, there are new antibiotics. So yes, LIS developers can make WHONET files without backlink, but it's time consuming in the short term. And it also requires a commitment to long-term maintenance. Otherwise, they might have a properly correct WHONET file from 2010. But if they don't keep it up to date, it's not going to have the organisms and the antibiotics that we add over time. So this can be done. There are some LISs in Finland that do this. They make WHONET files, so backlink is not used. There was one of the machines, Biomic, that used to make a WHONET file, but then they changed it that they do what everyone else does, is they just make an export file and then they use backlink. So yes, you do not need backlink, but it does make the work of the IT people much, much, much easier. I would like to do a comparison of backlink and a web page that many of you know, Google Translate. Backlink and Google Translate both have the same objective, to convert information from one language into another language. For example, in Google Translate, you might have some text in English or Russian and Chinese, but then you want to convert that same information into Spanish or Thai or Hindi. So that's what Google Translate does. Backlink does something similar. You have Excel data, or Vitek data, or SILAB data, or SEDRI-LIMS data, and we want to put that into WHONET. So we want the same information, but in a way that WHONET understands. So Google Translate has to understand two fundamental elements of any language: the grammar and the vocabulary. The grammar is how you organize the information, and vocabulary is the words. For example, on the English, I might tell Google Translate, good morning. And on the right, I say, how do I say good morning in Russian? Well, the answer is Доброе утро. My apologies for mispronunciation. Доброе утро, good morning. So that's what Google Translate does. Backlink does something very similar. Backlink must understand data structure, which is similar to grammar, and data codes, which is basically the vocabulary of your laboratory system. As an example, in WHONET, we have a field that we call date of birth. But maybe you don't call it date of birth. Maybe you call it birth date. Maybe you call it DOB. Maybe in Spanish, you call it fecha de nacimiento. So those are all the same concept, but the column heading is different. So backlink must understand how your column headings map up to the WHONET column headings. Same thing with the codes. In WHONET, we have a text cerebrospinal fluid. But many of you do not have cerebrospinal fluid, but you might have CSF, which means the same thing. Or in Spanish, líquido cefalorraquídeo. So we're basically taking the same concepts and putting them into a language that WHONET understands. WHONET only understands WHONET files. BacLink understands many different files with the objective to make standardized WHONET files. Oh, I guess I have this slide twice. Just ignore the second slide. Okay. So how do we get data from your system into WHONET? Well, step one is not BacLink. Step one is to get the data out of your system. WHONET does not have the ability to access your LISs. There are passwords and security measures which protect against attack from outside systems for very good security reasons. Also, even if we could break into your system, the data structures are complex. We don't understand them. We don't know how the tables get sorted or connected. So step number one to getting data into WHONET is getting the data out of your system. So we'll talk about step one, exporting data from your IT system. Step number two, again, before BacLink, look at the data that has been exported. Does it have the content that you want? Does it have a structure that BacLink will understand? And then step three, we finally get started with BacLink. Tell BacLink, I have a Vitek file, I have a SILAB file, I have a Meditech file. And the codes. WHONET, we have organism Escherichia coli, but you might have an organism E. coli, or you might have an organism like in Vitek, it is ESC-COL, the genus and the species. So it's always the same information, but the field names are different and the data values are different. So we tell BacLink how they match up together. After we do the configuration, then we can use BacLink to make a WHONET file. Once we're happy with all of that, then we can do number 5, getting started with WHONET. Those are the 5 steps generally. There's an optional step 6, automation. Sometimes people tell me, John, oh, I love WHONET, it's great, we use it, it's such a valuable software. And I say, what do you do with it? Once a year, I do my antibiogram. Once a year, I do my WHO GLASS or FAO in-farm reporting. And I say, great, I mean, you've done all of this work and you derive benefit once a year. But I try to convince people there is value to daily and weekly and monthly and quarterly reports for infection control, quality improvement, confirming unusual results to make sure they're not mistakes, like if you have imipenem resistant in some important organism. So steps 1 to 5 are to run BacLink manually. You run it manually whenever you want, once a month, once a quarter, once a year, at the end of a project, in the middle of a project. So steps 1 to 5 are manual steps. Step number 6, you have the ability to schedule this. Schedule it for daily or weekly or monthly. Those are the 3 I would generally recommend. Of course, you can do whatever you want, but those 3 make the most sense. So we'll go through each of these 6 steps, and then I will proceed with a live demonstration. Step number 1, export data from your system. Well, if you have Microsoft Excel or Access, you're already finished. The file is compatible with BacLink. So if you have Excel or Access, you're ready to get started with BacLink immediately. You don't need to export from Excel for BacLink to understand it. BacLink understands Excel. BacLink understands Access. So you're all ready. And you don't need the IT department to be involved. You already have your data structure. For laboratory instruments, most of the instruments, well, I'd say all the instruments basically, have some way to get the data out. They have a manual. You go to the export screen. You click on a start date, end date, you say export, you give it a file name, and you get a data file out. Some systems, and then so you don't need the IT department for that. You just simply need our instructions or the instructions from the vendor. We've had nice collaborations with the vendor to make some manuals together. So you don't really need the IT department if you have a Vitek or a Phoenix or a MicroScan, because we can tell you what the appropriate steps are. For some of the machines, you can configure the export. For example, with MicroScan, you they don't give you a default export. You say, I want the patient name, I want the date of birth, I want the location, I want the organism, I want the antibiotic results, and you say exactly what you want to export. It's a bit of a pain, but it's also very flexible. You decide what you want to export. On the other hand, Vitek, with Vitek, there are different versions of the Vitek software. There's Vitek Mila, Vitek 2, Vitek Observa, Vitek Maestria. I'm going to talk about the Vitek 2 software. The Vitek 2 software, you cannot configure the export. You press the button and the data come out. You put a start date, end date, the data come out. The nice thing is that it's easy. You don't have to do anything to prepare it. The unfortunate part is you can't configure it. For example, the Vitek export does not export age and gender. It's in the Vitek, but it's just not part of their standard export. You can get it through those other softwares I mentioned, like Vitek Observa. So sometimes you can configure the machine export, like MicroScan. Sometimes you can't export it, like the Vitek 2. And then Phoenix is nice because it gives you a default export called export towards WHONET, but it is also configurable. So they give you a nice place to start, but you can still configure it and tweak it further if you would like. So those are the machines. You don't need the IT department. Number 3, with the LIS, you usually do need the assistance from the IT department. For many lab systems, it's a simple standard feature that already exists. You might not even need the IT department. If it's up on the menu, if there's a menu option that says export, statistics, epidemiology, report, you just use that feature. Some of them, again, would be fixed. Other ones have to be configured. And sometimes you configure it from the lab perspective or the IT people configure it. So for many IT systems, it's easy to get the data out. For others, they do need to make an export. They say, well, we have the data. We can do this for you. I didn't even think of this for the slide. They say we can give you 2 options. We can put an export option for you on the screen so that you can do it, or we can do it for you on the back end. And their advantage is either way it can work. The big difference is that if they put it on the screen, the lab people do it manually whenever they want. On the other hand, if they do it through the back end, then often they can schedule it and they can say, I want a report every day or every week or every month. So for these systems, it's often not a difficult thing to do, but they do have to make an export for you, and you need to tell them what you want to export, and I will come back to that. Unfortunately, for some lab systems, especially, I go to some facilities, somebody made an IT system 5 years ago. That person is no longer available. They don't have any way to get the data out. Or sometimes the data are stored in PDF documents, and we can't extract easily data from a PDF document. So I would suspect most of you are in the situations here of 1 and 2, a standard feature that exists or another feature that can be developed. We do have explicit guidance on how to export data from Meditech, Cerner, Sunquest, SILAB. We can do it for SEDRI-LIMS. We have not yet made documentation for it, but we're in the process of collaborating with the developers to make documentation. So for many LISs, common LISs, especially the free ones, we can tell you what the steps are to export. And other ones, if it's an LIS that you made locally, we can give you guidance, and we have a document on how to do that. And you tell, in the final line here, you tell the IT department what you want. So you give them a list. In the human lab, first name, last name, date of birth, gender, if possible, it's not always possible, if possible, the date of admission. That's valuable for distinguishing hospital infections from community infections. You tell them I want the sample, the organism, the dates, the identifiers. If possible, the diagnosis, the physician. WHONET usually wouldn't use these, but you might want it. So you need to think about, well, what information is in your system and what information would be valuable for analyses. Sometimes people download the results for all samples, positive and negative. I do recommend that because if it's in the IT system, it's usually just as easy to download all of the results instead of just the positives. Some people only download the positives, positive blood cultures or positive urines, positive anything where there's some organism growing. Some people go further and only download the positives that have AST results. AST, I mean antimicrobial susceptibility test results. So they only download the positives with DISC or MIC results. If your focus is only AMR surveillance, then that can be appropriate. You just want the results, samples that have antibiotic results. I don't recommend that though. I recommend at least the positives, because WHONET is not only for antimicrobial resistance. If there's an outbreak of C. difficile, anaerobes, fungi, these are organisms that we usually do not do susceptibility testing routinely. But that doesn't mean they're not important. If there's an outbreak of C. difficile, you want to know it even in the absence of antibiotic results. So I would recommend at least all of the positives, irrespective of whether there are antibiotic results. But you could also just do all samples, positives and negatives. For purposes of WHO GLASS reporting, they would like that. They would like to know, this is not a resistance surveillance objective. It's more of an objective for diagnostic stewardship. How many blood cultures did your hospital do? What percentage were positive? What percentage were negative? What percentage were contaminants? So from your IT download whatever you want. I would generally recommend all of the samples, or at least all of the positive samples. Tell the IT people what you want, the data fields. They'll give it to you, and hopefully what they give you the first time will be perfect. But after they give you a data file, you still want to look at it. Content is the desired information in the data extract from a human perspective: name, ID, sex, age, date of birth, date of admission. For animal species, farm, veterinary clinic, or what are veterinary samples from the market, from the restaurant for food, or water sampling sites, soil sampling sites for environmental surveillance. So the file that your IT people gave you, is there anything important missing? Sometimes I've received emails, John, WHONET doesn't have the date of birth. I said, well, did you download it? And then they go back and no, it wasn't downloaded. Well, of course, if it's not downloaded, it's not going to be in the WHONET file. Sometimes you say things, John, WHONET is missing the imipenem. First question, was imipenem in the download? And that's where some people, sometimes if imipenem is added to a lab system, sometimes imipenem is automatically included in the download. That's easy. You don't have to do any extra work. Other times, if they set up the export, it is possible that it's possible the new antibiotics are not included. So whenever anything's missing, the first thing I go back to is to see if the IT people gave you the information in the file. Organism antibiotic results, at a minimum for the antibiotic results, we need the antibiotic name, like ampicillin, and the interpretation, RIS. That's the minimum. Antibiotic, ampicillin resistant. In addition, we would also like to know, was it DISC MICE test? Are they measurements like 10 millimeters, 12 millimeters, or MIC results like 1, 2, 4, 8, greater than 8, less than or equal to 1? So many LISs, unfortunately, only do the first two, ampicillin resistant. They don't tell you the method and they don't tell you the measurement. BacLink and WHONET do not need the method or the measurement, but you do get richer analyses. So if you don't have it, that's not a problem for BacLink and WHONET. WHONET will work fine. But for the richest analyses, yes, we do try to get the measurements wherever possible. You also tell WHONET, are you doing the CLSI method from the United States or the UCAST method or some other method? Most labs only do one. They do CLSI or they do UCAST. That's not always the case. Some labs, especially a lot of animal health labs like in Europe, for certain organisms and antibiotics, they'll use UCAST if there are recommendations available. For other things, they'll use CLSI, and BacLink does not have a problem with that. If you have the diagnosis, the name of the physician, the gram stain, we may not use this for analyses, but you might want to have that. If it's available, sure, go ahead and download it. If it's not available, then just ignore it. It's just not realistic. There are places, a few places where they download 98% of the data, and then they manually type in additional information, and you can also do that. So that way you download the LIS data, and I've seen people use this, for example, what freezer number? Where did we store that sample? And sometimes for blood cultures, they'll save it. So they will go to WHONET and manually type the freezer number, the box number, so they can retrieve it later. So that's a hybrid approach. You're downloading everything you can, and then you can manually edit and add additional details. Okay. So that's the data content. Format, are the data nicely structured? And by nicely structured, I mean, is it just simple rows and columns? If it's there are certain things that backlink can handle easily, especially if it's nice, simple rows and columns. We don't like free text. Sometimes Staphylococcus aureus, there are 20 different ways to spell Staphylococcus aureus incorrectly. Backlink does not have a problem with that, but it is a pain in the neck for you. S. aureus, Staph aureus, Staphylococcus aureus, Staph space aureus, Staph dot aureus. So this is not backlink doesn't care. But if you have a lot of free text, you're going to have a lot of mapping. And every month, it's going to be additional new free text codes as people spell things in a variable way. Also, date formats, I've seen with Excel, it often depends on who's entering the data. Some people put month, day, year. Some people put day, month, year. Some people put Y, month, day. And in Excel, it's mixed up. So it's actually, they're corrupting the data because different people enter the dates in different ways. Some people put the word January 2nd. So you want the data to be clean to avoid some of these annoying problems and data corruption. Each data element should be in its own cell. I've seen many cases where there's a column called result, and that column will say 1 E. coli, 2 Staph aureus, but they're both in the same box, and backlink can divide it up into 2 different organisms. I've seen other cases where they will put all of the resistant antibiotics into one column, all of the sensitive antibiotics into another column. And backlink doesn't understand that. We need the penicillin and the ampicillin to be in different columns or different rows, one or the other. So when they give you the data file, you take a look at it, and I'm trying to get a sense, is backlink going to understand this? The usually thing I tell them is just make whatever is easiest for you for 2 reasons. One is whatever is easiest for you is usually the easiest thing for them to do. It'll happen most quickly. They'll say, no trouble, I can give you something maybe next week, or I'm busy now, I'll give it something to you next month. So if you tell them, give me what is ever easiest for you, that's going to move the conversation ahead. That's one reason I tell people that. The second reason is whatever they do that's simplest is usually going to work. The default, simple, basic exports that most people do, backlink can understand. It's not always the case, but most of the time, whatever is easiest for them is sufficient for backlink. And then I talked about step 1 and step 2. If needed, you can go back and forth. Keep on going back to your IT people until you are satisfied. For example, you might say, everything looks good, but I don't see any C. difficile results, or I don't see any, antifungals or something. And then step 1, step 2, you will have a nice data file. Sometimes you need to clean the data. And you can either use Excel to clean the data, or backlink can also do a lot of cleaning. I generally recommend backlink because you only have to set it up once. But I'll talk on that on the next slide. So when you clean your data with Excel, some advantages. You have full advantage of whatever Microsoft offers you. Little secret, Microsoft gets paid more than we do. So Excel has a lot of capabilities that WHONET doesn't have. Something simple, if there are 20 different ways to spell Staphylococcus aureus, in Excel, you can clean that up just so that it's only one way. But the disadvantage of Excel is that can be a lot of work. Sometimes you have to do formulas to do the best cleaning, and not everybody knows how to do Excel formulas. And most importantly, if you have one file a month, every month you have to do the file cleaning. So you can't automate that. So Excel has some advantages for the flexibility of cleaning, but you can't automate it. And that's where we try to encourage you to use backlink features for automation. We'll have that on the next slide. Backlink does have a lot of cleaning abilities. For example, direct mapping, ESCCOL is maybe what you call it. WHONET calls it ECO for Escherichia coli. Or sometimes I have a file and And the file does not say that it is healthy land animals. That's a category from FAO, the Food and Agricultural Organization. And if I look at the data file, or I'll give another example of this, sometimes I get a data file and I say, well, I don't know what the organism is, and I don't know the specimen type until I look at the file name. The file name says Strep pneumonia blood culture study. So the file name knows it's Strep pneumonia. The file name knows it's blood, or the file might know it is all healthy land animals, and but it's not in the data file. It doesn't need to be in the data file if the value is always the same. So WHONET has a nice feature called fixed value to say all of these data are Streptococcus pneumonia. So we'll see a little bit of that. Then there's indirect mapping. For example, neurology ward. WHONET will copy that over to neurology ward. But WHONET also allows you to categorize it. That would be medicine and inpatient. This allows you to take the neurology ward and copy it to neurology ward so that we know the exact location. But WHONET has other fields called location type that we want to introduce standardization. At the national level, they don't care neurology ward, but they do care about inpatient or outpatient. They might care about surgery versus medicine. And maybe the local pharmacy wants to know medical versus surgical versus ICU. So that's indirect mapping. Portion of it is direct. Neurology ward becomes neurology ward. But we're adding on information. Some people call that metadata, meta information about the ward. Similarly, you might have animal data from the Purdue farm, number 10. Purdue is a common producer of chickens here in the United States. So we'll just call it the same thing, Purdue farm number 10, but we'll give it the category of farm, because at the national level, we want to know the category more so than the exact, well, you want to know both potentially. So WHONET does allow you to do that indirect mapping. So why would you clean data with BacLink? You have decent flexibility. You can do a lot of cleaning, like with spellings. It's more convenient for repetitive conversions. So if you're doing conversions every month, every week, every year, you don't want to have to manually clean the data each time. If there are 20 different ways to spell Staphylococcus aureus, you just have to define it once. And then in the future, BacLink, you don't have to clean the spelling because BacLink is cleaning the spelling for you. Disadvantages, there's less flexibility than Excel. Sometimes I'll do little formulas in Excel to try to clean the data. For example, if the location is Purdue, then it's chicken. And for meat, Purdue does meat chickens. So you can do things in Excel that BacLink is not set up for. So I'll show you some of the mappings today with location, specimen types, organisms, and antibiotics. Just take a quick look at the time. Adam, I'm going to stop soon for a break. And if you could just start looking if there are any chat questions. Thank you. So that's step 1 and step 2. Step 3, configure BacLink. So now finally we're getting to BacLink. So obviously first thing you do is you install BacLink. Then after install it, BacLink needs to know the language, which French, Spanish, German, I didn't put that on the slide. BacLink wants to know what country you're in, what your code is for your laboratory. Do you want to import birth date? Do you want to import MIC, DISC, Vitek, SEDRI-LIMS? So if you say Vitek or SEDRI-LIMS, BacLink already knows the answers. BacLink knows, in Vitek, I'm trying to remember the exact words. In WHONET, we call it identification number. Vitek calls it patient ID. It means the same thing. So BacLink already knows that. BacLink already knows the complete Vitek organism list and the MicroScan list and the Phoenix list. So BacLink already knows a lot of this, which saves you a lot of time. So you only have to do the configuration once. Prospectively, you might need to put new antibiotics, new organisms as they appear. But for the basic configuration, you just set that up once. That's for the structure. And then codes and dates. Do you do day, month, year, month, day? Your BacLink doesn't care. But BacLink needs to know. If yours is year, month, day, you tell BacLink it is year, month, day. And then your data codes for sex, specimen, organisms, like some people have M and F, male and female. Others have 1 and 2. Others have the word male, the word female, and it would depend on the language, masculino, feminino. So BacLink just is helping them to convert to the WHONET terms, which in this case are M and F. As part of configuration, BacLink is going to ask you, do you do CLSI, UCAST, mixed, other? Do you do disk MIC, just one method or multiple methods? I'm going to spend more time on this point. Is there one record per antibiotic? Is there one record per isolate or one record per antibiotic? I'll come back to that. Finally, do you have measurements like 6 millimeters and MIC of 128, or interpretations, or both? Going back to question number 3, organization. When people enter data into Excel manually, typically they put one row with all of the results. Excuse me. John Smith, blood, E. coli, ampicillin, penicillin, ciprofloxacin, everything is on one row. That's very typical of Excel data entry. And some of the machines do that. However, most LISs and most machines put the antibiotics vertically. If, for example, you have an E. coli with 10 antibiotics, there'll be one row for ampicillin, one row for trimethoprim, one row for cipro. BacLink doesn't care. Either one is fine. You can put the antibiotics horizontally. You can put the antibiotics vertically. I'll show you an example of both. BacLink just needs to know what the correct answer is. That was step 3, configuration. Step 4 is converting the data. You tell BacLink what kind of data I want to import my Vitek data, for example. I give it the name of the file that I exported from the lab system. And then you enter a new name for the new WHONET file that you're about to create. And so when you start BacLink, you have a single file that is extracted from your system. At the end of BacLink, you have 2 files, the original file from the data extract and the new WHONET file with the same information, but in a structure that WHONET can understand. WHONET suggests a name. You don't have to use the name suggested by WHONET or by BacLink. You can give it a different name. The problem with the WHONET name is that it's a bit long. It will say, for example, Sweden, but you can delete it if you know where you are. So, but you'll see that during the live demo. Then you say begin conversion. BacLink will show you the first 3 isolates just to make sure there's not some obvious mistake. If the person's name is John Smith, that's fine. If the person's name is E. coli, then you made a mistake somewhere. Either the data corrupted or you made a simple mistake in the field mapping. And BacLink just shows you the first 3 to make sure that the fields, everything's going to the right place, that the date format is correct. If BacLink doesn't understand something, it will ask you. Some things BacLink does automatically. If your code, it's not exactly a code, but if your text is the word blood, or the word sangre, which is Spanish, Blut, which is German, or Krov, which is Russian, BacLink can automatically understand that, and BacLink will say, oh, I know what that is, that's blood. Okay. For other things, BacLink will say, I'm not sure. You have something called CSF. We don't have CSF. And you say that's the same as cerebral spinal fluid. We're going to make BacLink smarter, so there's some things it can understand automatically. Okay. Once you tell BacLink, once you tell me a word in your language, I'm going to forget 5 minutes later. Once you tell BacLink what something means, it will remember forever. So if there are codes I define in January, I don't have to define them in February. That's the idea, that if you're doing this in Excel, you have to repeat it every month. But if you're cleaning it with BacLink, you only have to do it once for each code. That was step 4 of the conversion. Step 5, getting started with WHONET. BacLink and WHONET do not talk to each other, because a lab might have one WHONET need, but they might have 3 backlinks. They might have a Vitek and a lab system and a special Excel file, a special research project. So that's why BacLink and WHONET don't talk to each other, because they're not always, they're sort of serving different purposes. So WHONET doesn't know about the work that you did with BacLink. So when you go to WHONET, you want your lab to appear on the list of WHONET laboratories. One way to do that is you click on New Laboratory in WHONET, and you do it from the beginning. But there's a much better way. We have created a shortcut, and I'll tell you about the shortcut later. Finally, task automation, optional. For many systems, you can configure the automation of data exports so that you don't have to do it manually once a year or once a month or once a quarter. you could schedule for daily, weekly, or monthly processing. Step number one is not up to us here in Boston. Step number one is up to your IT people. How do you export the data from your system? Can they schedule a weekly or a monthly export? SEDRI-LIMS, Meditech, Cerner, most of these do have the ability to set up a scheduled export. Most of the machines do not. So if you're trying to get the data out of the machine, most of the machines, you have to walk to the machine and you do the export manually. But if you're getting the data out of the LIS, usually they can be automated. We can give general guidance, but they're in control of that. We cannot access your system to export the data. That would be a violation of security protocols. Once the data are exported from your system, we can help you the rest of the way. We've created a tool called the WHONET Automation Tool. You can use the Windows Task Scheduler. There are many commercial, non-commercial ones. You can do that. Or you can use the WHONET Automation Tool that we have made for you, which has additional functionalities besides only scheduling. And we have materials on the website on how to do that, or you can just ask us for assistance. So automated data export from the LIS, automated backlink, and then automated analyses. I want an automated list of MRSA from the NICU, the Neonatal Intensive Care Unit. I want a monthly report for the pharmacy. I want a weekly report for infection control. I want a yearly report. Well, you don't usually schedule yearly, but you can. One thing which I don't mention on the slide is you can generate reports on a schedule, and you can also email them. And they're doing this very nicely now in Eswatini, where all of the above steps are happening automatically, and then they email the laboratories at the end. So the laboratories are getting a lot of benefit without the additional work. We want you to focus on analysis, interpretation, data use. We don't want you to spend all of your time focusing on data acquisition and cleaning and data conversions. So now I'm going to do a backlink demonstration after going through questions and answers. Number one, you choose the language. Then I'll go through the basic backlink configuration, capture the priority data fields. What do I mean priority data fields? Organism, identification number, date, time, antibiotic, not time, but date, antibiotic results, etc. And then convert data. So you'll have a basic WHONET file that is ready for analysis. But before going to WHONET, I'll go to part 2 and do some optional additional things that you may want to capture. It's a bit more advanced, which is why I separated it into 2 parts. Not only more advanced, it's also less needed. Most people don't use these additional features. I want to make sure through this webinar you feel somewhat comfortable with part 1 and part 2, just so that you know that it does exist. And then getting started with WHONET. I'll show 3 sample data files. 2 of them are part of the WHONET installation package. One of the comes with the Vitek 2 demo data. One is called Excel, and you have access to those when you download WHONET. I'll also demonstrate SILAB, which is a veterinary lab information developed by IZS in Rome. I'm sorry, not in Rome, in Teramo, Italy, with the active support of the Food and Agricultural Organization. I was in Ethiopia last week for a regional meeting of animal health laboratories in Africa. SILAB is used in approximately 20 countries, mostly in Africa, and a few in Southeast Asia that are piloting it. So summary, backlink is a free software distributed as part of the WHONET package. If your laboratory has a data management system, then backlink can be very valuable for you. If you don't have an IT system, you don't need backlink. Your data are on paper. You can make WHONET files without backlink, as I mentioned, but this usually takes more time and effort and the commitment to the long term. You can use backlink to capture data manually on a weekly, monthly, quarterly, yearly, or ad hoc basis whenever you want, or you can use backlink to capture data automatically. Download an installation. Well, I'll come back to that later. I'm going to exit out of that, and I'm going to close my mailbox. Adam, are there any questions that I'm going to stop sharing my screen for a moment? Oh, how about SensiTiter? Can we use backlink also? The answer is yes, you can. SensiTiter is not often used in human clinical diagnostic labs. I'm sure it is. But in human clinical diagnostic labs, mostly we run into Vitek, MicroScan, Phoenix, and a few others. But we do see SensiTiter very often in one health projects, especially with the animal and food. So FAO has collaborated closely with the SensiTiter it used to be called Track Diagnostics. I forget their current name. I do know it, but to make panels, to make veterinary animal health panels for bovine and porcine and aquatic. So yes, you can use SensiTiter. The one odd thing about the SensiTiter export, most data files that you have ever seen in Excel and exports, there's usually a field heading. The SensiTiter export doesn't have a field heading. There's not a problem with backlink, but it's basically like field 1, field 2, field 3. And backlink knows which field is which. But yes, you can use backlink with SensiTiter. It is one of the standard options. So Adam, no other questions at the present time?
There were just a few that came in just now.
Okay, sure. Okay, starting through 753 about the API. Is it possible to send data through an API? At the present time, no. We have discussed it. We've talked about it. In theory, we could develop it. But on the one hand, most people wouldn't know what to do with it or wouldn't be able to use it. On the other hand, we're a tiny team and we just haven't had time to dedicate to that. So I would say it's something we would like to offer at some point, but no, at the present time, you cannot have an API. API is an application programming interface. So I was talking about manual export and manual import or schedule it. API is a bit more, it's a bit more of a real connection, like a live connection. So we do not support that at the present time. Question, can we have the presentation after this meeting? Greetings from Mozambique, thank you. Definitely, Adam, will we have the, not the video, but when do you think we'll have the PowerPoint? When do you think we'll have the PowerPoint and the video up?
It should be uploaded later today.
Okay, great, thank you, thank you. Oh, and someone just says, yes, we use SensiTiter in healthy food animals. And again, we usually see SensiTiter in the context of animals and foods. It's often done in batch. You might collect a lot of samples and, often it's not the diagnostic labs, the doctor's waiting for the result. I first came very familiar with SensiTiter with the US NARMS project, National Antimicrobial Resistance Monitoring System, with the US CDC, the US Food and Drug Administration, the US Department of Agriculture, and they agreed on using SensiTiter because they could have full MIC panels. The problem with a lot of machines is they only have breakpoint panels. They have 2 concentrations, 3 concentrations, because for diagnostic purposes, you often want fewer dilutions with more antibiotic choices for the doctor. For public health surveillance and research, you often want fewer antibiotics, but wider distributions of MIC values. So that's why you often see SensiTiter for the full MIC values in a number of these public health oriented projects, especially from the One Health or animal health perspective. For microbacterial DST, we use SensiTiter, and that should be compatible. WHONET does include bacteria, fungi, generally speaking, bacteria, fungi, parasites, viruses, no growth, normal flora, as well as microbacterial testing, antifungal testing. At the present time, we have not put antiviral testing or antiparasitics. There's not been a strong demand for it. It's not as if we couldn't, but there are complexities. With antiviral, there's phenotypic methods and there's genotypic methods. So at the present time, we have focused on the various kinds of bacteria and fungi. And we have 2 thank yous there. Okay, can you please share the presentation? I've answered that. With regards to FAO Inform, how can backlink be utilized? And right, and you've already provided a partial answer. So we are doing, in July, I went to Bangkok for FAO for a regional training to Asia Pacific countries on backlink and WHONET for Inform. That's what I did last week as well with Ethiopia. So you're asking how can it be utilized? Basically, in the normal way, you take your data from your lab information system to make a backlink file. In the normal way that we're going through here, we're just making a WHONET file. And then in WHONET, there is a feature that says export to Inform. So basically, the way we do with Inform is a little different from what we do for everything else. It's just normal WHONET. They do have 3 special fields. They have a lot of optional fields about the animals and about the methodologies, but there are 3 required fields, one called data year. that's usually a pretty easy one. It's related to the specimen date, date a year. The two other questions are called surveillance program, and they have 5 choices. Five choices. Healthy terrestrial animals, diseased terrestrial animals, healthy aquatic animals, diseased aquatic animals, and finally food commodities. So everything that I'm telling you now is completely relevant for FAO and in-farm reporting, but you do have to add in these 3 additional variables at FAO's request. For them, it's very important to know, it's often not possible in the short term, but I'll come back to that. So FAO would like to know healthy versus diseased animal. They'd like to know land versus aquatic animal or food commodity, and a lot of the IT systems do not currently have the granularity that FAO would like. For example, FAO does not have a code in farm for chicken. They have 3 codes. They have 1 code for chicken broiler. Those are the meat chickens. 1 code for chicken layer for the egg producers. And the 3rd one is backyard poultry. So if you have a chicken farm, they don't want you to just call everything chicken. They'd like to know which kind of chicken it is. And when I see some of the animal health data, sometimes it simply says avian. And avian is predominantly going to be chicken. So a lot of the LISs for the animal health, it's not a limitation of the LIS, but it's a limitation, because I've seen these places, they do have a code for chicken. It's just that they'll often just call it avian. They know it's a chicken. The veterinarian knows it's a chicken. The farmer knows it's a chicken, but in-farm doesn't know it's a chicken. The in-farm just knows that it's an avian. So with in-farm, over the next few years, FAO will promote trying to integrate some of these elements of granularity to get better, more complete data. This is only the first year of in-farm, so there's a lot of lessons learned. So farms are aligning themselves to try to match the requested granularity from FAO. For example, same thing with swine. They try to distinguish between commercial, industrial swine production or backyard swine. Great. So there are 3 fields I mentioned: data year, surveillance program, healthy, diseased, land, aquatic, food. The 3rd one is called data representativeness. And the 3 choices for that: national systematic program. We have a national comprehensive system that looks at basically all available data. That's 1 choice. The other 2 choices are pilot local. You just have a few labs collecting data, or pilot national. So pilot national would be, you don't get data from all the labs in the country, but you try to get data, pilot labs that are representative of the country. That information is usually not in the data file itself. It's information that I know, for example, all of my data are healthy chickens, or I know that all of my data are a pilot national program. So that's valuable information as a fixed value that is not appearing in the data file itself. So 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 we completely support FAO. In fact, I was on with FAO at 4 o'clock this morning. There's a 4-week virtual learning center series on in-farm. So WHONET is week number 3. So for people in Asia and Africa, and I think Latin America is also involved, these are so you may want to discuss with FAO opportunities for education, and the materials will be available. We are creating a virtual learning center course so that you could also take the course on your own separately. Okay, great. So let me go back to share and let me get to the live demo. So before starting with WHONET and BacLink, let me show you what data look like. And if I go to the C drive, you see my WHONET folder, you see my data folder, and you see a few files here at the bottom. First, I will show you the Vitek demo data. Instead of showing it to you in this format, I'm just going to copy paste this to Excel. In Excel, it's going to be easier to understand what is happening here. Great, the data are now in Excel, and the data are now separated into columns. So this is what an Excel file looks like. These are real data, but I've deleted the confidential stuff. John Smith, these are just, random names that are common names in the United States. So this is the kind of information that WHONET wants. But WHONET doesn't understand these things. The lab ID, oh, I said patient ID, it's actually called, so lab ID, in WHONET, we call it specimen number. Isolate number, we call it the same thing. They call it patient name, patient ID, we call it identification number, patient location, specimen type. We also call it specimen type. So sometimes we call it the same thing, sometimes it's different. Collection date, we call it specimen date. Testing date. You see, the Vitek always knows the testing date because the Vitek did the test. The collection date, however, has to be done manually. So sometimes you'll see the collection date is missing because nobody typed it into the Vitek. It's not the Vitek's fault, it's just that the information was not entered. The organism name, I don't know why they do this. They call it Esch coli. Normally, I'd expect to see Escherichia coli. I guess they just shortened it to make it fit better on a clinical report. I don't know. Bio number. I do like these bio numbers. So these are special fields for Vitek. I find them valuable. People often ignore them. And that's an example of things that often I would like to see that are not standard WHONET. And then here you see the antibiotic results. They put AB, amphotericin B, AM, ampicillin, the Vitek data. This is what I will call horizontal antibiotics. If I look at rows 1 and 2, all of the data for isolate John Smith are on this one row. The antibiotics here are in a fixed order. Amphotericin, ampicillin, augmentin, amikacin, ceftazidime. This is what I call horizontal fixed sequence. That's one example. And you also see age and gender are not here, and that's because the Vitek 2 does not export it. Other versions of Vitek do, but not Vitek 2. Let me show you what, I'll just show a simple Excel file now. So here, Excel demo. I just typed this off the top of my head. These are not real data. So many of you have seen Excel files like this. Medical record number, birth date. We don't call it birth date in WHONET, we call it date of birth. In WHONET, we don't call it ward. In WHONET, we call it location. Collection date, microorganism. In WHONET, we call it organism. And you see 3 disc diffusion antibiotics, ampicillin, ciprofloxacin. So for each antibiotic, I have a single column, 6 millimeters, 22 millimeters. It does not say anywhere here that is this diffusion data, but it is. So I do not have a mixture of disc and MIC. Sometimes there is a MISC. Sometimes there is a column that says method. And then it'll say disc and disc. Sometimes it'll say MIC. Sometimes it'll say e-test. These are all correct. There are many correct ways. So BacLink is not going to tell you this is wrong. BacLink says, please tell me, once you give me the details, then BacLink says I will be able to interpret and read it for you. So this is just a simple Excel demo. We just put 3 antibiotics to make it easier. I'm going to close that. And now I'm going to open up the SILAB demo. In real data, but I just changed all anything confidential. I called everything demo. And I called it owner number 10, owner number 2. So here what we see is this is a lot of fields that are exported by SILAB. They have a field, this is the veterinary system, they have a field called diagnosis. I'm sorry, they have a field called sampling purpose. And here they distinguish between passive AMR surveillance and diagnostic testing. Some territory 1, territory 2, territory 3, that would be, for example, like province, state, city, district, municipality. In different countries, the words are different. So generally, they just call it level 1, level 2, level 3. Liver, lapine. Lapine means it's a rabbit or it's similar to rabbit. Ovine means it's a sheep or it's similar to a sheep. Avian, domestic, which is probably a chicken in most cases. Lung, avian carcass. Staphylococcus epidermidis. So here you see Staph epidermidis 4 times. Does that mean there were 4 Staphylococcus epidermidis? No. You see, there's 1 antibiotic on each row. I see amoxicillin, clavulanic acid, gentamicin, tetracycline, trimethoprim sulfa. So I talked about antibiotics being horizontal. That's what Vitek does. That's usually what we do with Excel. And talked about antibiotics being vertical, and this is vertical. There's 1 antibiotic on each row here. If you have something like a Candida albicans, Often there are no antifungal results, so we just leave that empty. We still like to see it because it does cause outbreaks, it does cause infections, but there are no antibiotic results. So that's also very possible. So you just put a row with the organism, but with no antibiotic results. So again, this is exactly the kind of information that that WHONET would like to work with. But BacLink does not understand tetracycline 30G, amoxiclav. BacLink doesn't understand these things directly. Okay, good. So those are my 3 examples. And now finally, I will start with BacLink. BacLink main screen. One thing I could do is I can click on select language and I can say, French. Everything is now in French. I can say Chinese. Now everything is in Chinese. So we don't have a different software for the different languages. Everything is here. We have used Google Translate and Amazon Web Services translation. These are very good, but they're not perfect. So if you see a translation that's incorrect, please help us out and tell us, and then we can fix it. I'm going to show you something a bit funny. So if I go to translate and I say, for example, hello, that's hello in Privyet in Russian and Spanish. But let me put, for example, the words blood. Blood in Spanish is sangre. I'm going to put the word stool here. The word stool is heces. That is correct. That is how you say stool in Spanish. But if I put French, it says tabouret. That's funny. Tabouret. Word English. This is also a stool. So Google Translate doesn't know what kind of stool I mean. So you'll see in WHONET strange translations because the translation system is confused. So if you do see strange translations, let us know and we can fix it. Okay, I'm going back to BacLink I'm back on English. Okay, good. Okay, I'm back in English here. So, and let me delete that just starting. So basically, I want to teach BacLink a new language. And I click on, in WHONET, we click on new laboratory. In BacLink, we click on new format. And I say my country. I was in Ethiopia a few days ago, so I'm going to put Ethiopia. And I'm going to call this BacLink demo. And let me just call this, BLD, BacLink demo, whatever code you would like to use. As a language has grammar and vocabulary, a file has structure and codes. So what is the structure of this file? And I'm going to start with the very simplest one, Vitek, which actually gives me a different idea. We're going to forget about WHONET for a little bit. I can show you here on the main screen. Let me exit out of that. Save changes now. Help. Documentation. So if I look at the documentation, you can see BacLink getting started, BacLink in Excel, BacLink in Lab Information Systems, BacLink in Meditech, MicroScan. We have SILAB. We have we do not yet have SEDRI-LIMS, so we need to expand this list. Then we have our WHONET tutorials. How do I get the data out of the Vitek? That's step number 1 before BacLink is to get the file. How do I get data out of the Vitek? Well, anybody who here has Vitek knows this is the main screen. Lower right, click on Export Inactive Isolates. Put a start date and an end date. Here in the top right is the export icon. BacLink, Vitek says, I found 11 isolates. Do you want to continue with the export? I say yes. I put in the name of the new file, for example, January 2025, etc. And then after that, I click here where it says export inactive. I say export. BacLink, I keep on saying BacLink. Vitek will say export completed. And now there is a new file here. I'm not going to go through that in great detail because every system is different. So if I go to SILAB, BacLink and SILAB. This is the SILAB main menu. Whoops. Okay, there's a menu option called statistics. There's one called statistical data. Click on statistical data. At the bottom of the screen, it says export Excel, export AMR. This one does not ask you to give it a file name because it always gives it the same file name. So I'm not going to go into detail because, and I don't know, I think we have one on SensiTiter. I'd have to double check on that. So each machine is the same general idea. Go to the export screen, put a start date, end date, give it a file name, click export, and that's where those files came from that I showed you, the SILAB one and the Vitek one. There's Excel, I just manually typed that. So that was step one from my earlier presentation, getting the file. Step two was inspecting the file, and I did that in Excel. New format. Then I'm ready for step three, Ethiopia, backlink demonstration, BLD, file structure. And backlink can understand text, Excel, Phoenix, MicroScan, 2 options, SensiTiter, 2 options, Vitek. Alice is for Uganda. Malawi uses Bliss. Asiar's net is in Asia. FAO, India, Infarm. Lab book is from the Mariu Foundation. Meditech is commercial. Miklis is Croatia. I'm sorry, no, Miklis is Norway. NORMS is US. OpenLDR is from the APHL, Association of Public Health Labs. SEDRI-LIMS is from ARCTA, I believe, which is supported by Wellcome. Senite is from NARA Labs. The SILAB is from the veterinary group, from the IZS group that I mentioned. So if you are on this list, we can generally tell you how to get the data out. If not, just call it a text file or the Excel file and follow our instructions or what you learn on this webinar. So I want to start with the Vitek because the Vitek is the easiest. I go to Vitek. Vitek uses a comma delimiter to separate John, comma Stelling, comma blood, comma urine, comma E. coli. I don't have to answer these other questions, so I won't discuss them. Basically, the data are here on the WHONET data folder. If the data are someplace else, just tell WHONET backlink where the data are stored. Antibiotics. You see here, backlink is saying CLSI, 1 row fixed. Let me change this back to text. If I say text, backlink doesn't know what kind of data these are. If I say Excel, backlink does not know what kind of data these are. If I say Phoenix, Phoenix does disk and MIC. If I say Copernico, which is associated with Vitek, it's disk MIC. MicroScan export is MIC. MIC. Osiris is disk. SensiTiter is MIC. You go down to the Vitek. So Vitek, it is MIC data when you export data from the Vitek 2 software. By default, it is CLSI, and there is 1 row for 1 isolate. All of the antibiotics are on that 1 row in a fixed order. Penicillin, then Cipro, then ampicillin. There's 1 method, and there's 1 method. There's 1 method MIC, therefore there's 1 method on a row. So backlink knew the answer to these questions because it's a Vitek file. If I say antibiotics, normally there'd be a lot of questions here. I don't see a lot of questions because backlink already knows the answers. I'm not going to ask you a question if I already know what the answer is, and that's what backlink is doing here. So you can change from CLSI to UCAST, the French method, which is very similar to UCAST, or multiple guidelines. Maybe some of your data are CLSI, some of your data are disk. So that is also an option. For now, I'll put CLSI. And I'll click on data fields. Oh, let me just read the text here. Data fields, define the relationship between your data fields and WHONET data fields. Well, in fact, I don't have to do that because backlink already knows the answer. I'll show it to you, but the work has already been accomplished by us here in Boston. When I click on data fields, backlink knows that what we call identification number, they call patient ID. What we call full name, they call patient name. What we call location, they call patient location. What we call specimen date, they call collection date. What we call organism, they call organism name. So normally I have to match those things up, but backlink already did that for you. So I don't even have to come to the screen because it happened automatically. I say, okay. I'm going to exit without saving this because this time I'm going to stop talking and just emphasize how easy this was. New format, Ethiopia, backlink demonstration, BLD, file structure is Vitek, Vitek 2. I am finished. I'm going to click on OK. I'm going to click on Save. Backlink suggests a name. I can change the name if I want, but I won't. I'll say Save, and I will say OK, and I will say Exit. That's how easy it is to configure WHONET for Vitek and many other systems where WHONET knows the answer. SILAB and SunQuest, they're all the same way. You don't have to do the mapping because we have done the mapping for you. On the other hand, if you have Excel, then text files, then you have to do the mapping yourselves, and I will get to that. So this is the language I want to import, the backlink demonstration database. I click on Browse to find that file. There it is, Vitek demo. Backlink is suggesting a name. It's a rather long name. Ethiopia BLD Laboratory, and then it's just the original file name. But if you know what country you're in, and if you know what laboratory you're in, you don't necessarily need all of that. So basically here, all I've done is I've taken the original name and I just changed it from text to SQLite. So if you want, you can shorten the name. Keep in mind, if you send these to your national data manager, the national data manager, they would like to know which laboratory it is. So it's often good to keep the laboratory code in. The country, everybody knows which country you're in. So it's up to you. Backlink suggests a name. You can change the name if you would like. So I'm going to say the main reason I changed the name is just to make it a shorter name because the WHONET names can be a bit long. So I'm going to say begin conversion. Oh, actually, the other thing I can do here is I might want to say Ethiopia 2025. I might actually say what the time period was. That way they know exactly what it is. I'm not going to do that. I'll just use the defaults and I'll say Vitek demo. Okay, good. I'm going to say begin conversion. Oh, I guess I have to do this. So let me put here the same Vitek do demo data. I don't need the 2025. Okay, good. Begin conversion. As you heard earlier, backlink is going to show me the first 3 results. There it is. And identification number, that looks okay. Full name, that looks okay. It just gets broken down to John Smith. The location is ICU. The specimen number just gets copied. The antibiotics look great. They called it ciprofloxacin. We call it CIP. They called it clindamycin. We called it CLI, because we know the mapping of those antibiotics. I do notice a couple of things. It's having trouble with the date. And that's because not every Vitek is more or less the same, but they don't use the same date format. The date format is up to the local user. So this Vitek data is year, month, day. And backlink says, I don't understand that. So that's something we need to fix. And it's very easy to fix. Yep. Blood. You see here it says organism and local organism. You see specimen type and local specimen type. They call it staph hemolyticus, we just copy it over. They call it blood, we just copy it over. But WHONET is smart, backlink is smart enough to know the WHONET code. They call it staph hemolyticus, but the code is SHL as far as WHONET is concerned. They call it blood, but in WHONET is BL in English. If I change the language, it would be SA. So overall, I would say that worked pretty well. Everything looks good, except the specimen date is not correct. It's didn't understand it. The bio number is fine. I like the bio number for scientific purposes. Most people don't use it, but I do find it valuable. And the testing date is not accurate. These last ones are not general WHONET backlink fields. They're special ones for Vitek. So overall, I'd say that worked pretty well, except for the dates. Isolate number 1. Next. Isolate number 2. Looks good. It's basically the same issue. The date, it's having trouble with the dates. Next. James Brown, 3 South. The date is a problem. Next. It did the first 3, and then it did the rest. And because I was talking so much, that took 2 minutes. The number of isolates is 28. Continue. BacLink did not understand all of the codes. Do you want to review the new codes now? I'd like to go back and fix the date right now. So do you want to review the unrecognized codes? Not yet. I'm going to say no here. I'm going to go back to edit format. You saw me go to file structure, but you didn't see me go to codes and dates. So let me go to codes and dates now. And here, see, the problem is that BacLink is looking for MDY, month, day, year, with the slash symbol. But this particular file is year, month, day, using the hyphen. Date of birth, well, this file does not have date of birth, but I'll put that anyway. So BacLink doesn't care what your date format is, but BacLink does need to know what it is. The file that I showed you was year, month, day. I fixed the specimen date. There's also a special Vitek field, the testing date. That is not on the screen. It's not a normal WHONET field. But if I click here at the bottom, modify the list of data fields, and I go to the bottom here, it says testing date. Month, day, year. No, let me change this as well. Year, month, day. I say OK. I say OK. I say save, and I say OK. I say exit. I do begin conversion. BacLink says, this Ethiopia Vitek file already exists. Do you want to replace it? Yes, I do. I'm just replacing, I'm not deleting the original file. I converted the file once. It was pretty good, but I want to make it better. So do you want to replace the first test? Yes. And here you can see the date is now correct. That 2014-0602 is June 2nd, 2014. And I also fixed the testing date. The testing date is June 1st. Isolate number 1 looks good. Next. Isolate 2 looks good. Next. Isolate 3 looks good. Next. This time it only took 40 seconds because I talked less. Still 28 isolates. Let's continue. Same question. BacLink did not understand all of the codes in your data file. Do you want to review the new codes? Yes, I do. It understood all of the organisms and all of the antibiotics. Why? Because bioMérieux gave me the list, so I do know what the list is, so it didn't ask you for any of the antibiotics or any of the organisms. Of course, our dictionary is not always 100% up to date, so if there's some organism, new Vitek organism or new Vitek antibiotic, not a problem. BacLink will say, I don't understand this new antibiotic, can you please tell me what it is? And then you define it here. And then, of course, Adam and I, we should once in a while get the updated list from the vendor. But if we don't, you just define it yourself, very easy. So look, it understood the organisms, the antibiotics. It did not understand, it understood blood, it understood urine, it understood stool. It did not understand sputum sample. WHONET says, I don't know. BacLink says, I don't know what sputum sample means. BacLink is not completely intelligent. It tries to help, but it doesn't want to take a wild guess and be wrong. So how do I define that? Well, I click on the row specimen type, and there are only 2 codes it didn't understand. 2. Those 2 codes happened in 8 samples. Define codes. Now it's showing me a vertical list of the different codes it didn't understand. I click on sputum, define code. And BacLink is trying to help out here. What does sputum sample mean? Does it mean induced sputum? No. Does it mean sputum for acid-fast bacilli for tuberculosis diagnosis? No. Sputum sample means sputum. So BacLink is trying to be helpful, but BacLink does not want to guess when BacLink is not sure. Urine, urine, stool, stool, blood, blood, that's fine. But sputum sample, BacLink says I'm a little bit unsure here. So I'm going to say, okay. It disappeared from the list. That is now fully recognized. Catheterized urine. I want to click on define code. BacLink is trying to be helpful, but in this case, it did a bad job of that. BacLink is asking, catheterized urine? Is that the same as urine non-catheterized? No, in fact, it's the opposite. Catheterized urine is not non-catheterized urine. How do I help that? I just have to change the search. Let me just search for urine. It's the one it found, but that's not correct. It's urine from catheter. It's confused by the word catheterized. Because we had the word catheterized, it thought this was the better match. But the better match is just the word catheter. So if you see the code, great, you choose the code. If you don't see the code, you just do a search. I'll put blood, I'll put, it'll do a search for you among the human, animal, food, and veterinary options. I type urine catheter is the best match. They call it catheterized urine. WHONET calls it urine from catheter. You say, okay. Now BacLink understands all of your specimen types. Now I'll take a quick look at the View Code Dictionary. You don't have to do this, but it's nice to know that it exists. BacLink is building a dictionary. Let me take a look. Blood, it understood without asking you. Urine, wound, throat, stool. It asked for help for the last two. So BacLink automatically did the first five. I manually did the last two. Sputum sample becomes sputum. Catheterized urine becomes urine from catheter. If there's a mistake, I can edit it and fix it here, or I can delete it and just fix it next time, or I can edit the table and then save it when I finish making changes. I'm just going to click on exit. So BacLink now understands all of the specimen types in that file. I click OK. Location, define codes. And they're sorted here by how frequent they are. The most common code is outpatient. It happened 8 times. ICU twice, 5 North twice. If I click here, I can also do it alphabetically. Sometimes that's useful for the organisms. If you have Staph aureus spelled 20 ways, alphabetize it by Staph aureus, and then so I can match all of these at the same time. Makes sense in this example, but yeah, sometimes I want it sorted by how many there are, and sometimes I want it sorted alphabetically, depending. If I want to do many at the same time, I'll often do it alphabetically. But let me do it by number. Okay. Oops, I didn't mean to do that. Number. Good. So outpatient, they call it outpatient. I'm going to click on define code. I talked about direct and indirect mapping in the PowerPoint. They call it outpatient. We're going to call it outpatient, description outpatient. But in the bottom, we can do that indirect description. And BacLink is asking, well, what do they mean by outpatient? Well, what they mean is we call it outpatient. In fact, WHONET does use the same word in this particular example. So we're categorizing it. The department is outpatient. The location type is outpatient. I'm going to say, okay. That's now matched. Better example, let me go to 5 North. Define code. They call it 5 North, we call it 5 North. But I have the opportunity to say that 5 North is medicine, inpatient. Let me go to 3 South. I can say that this is surgery, inpatient. They call it emergency room. In WHONET, we simply call it emergency. And a location type is emergency. What any other? Burn unit. I'm not going to do all of them. Burn unit, that's an example of an intensive care unit. Location type, also intensive care unit. Okay. What have I done so far? I'm going to click on View Code Dictionary. And here you can see the mapping. The columns on the left, 5 North, 3 South, are especially valuable for the local infection control team. They want to know the exact location. The 2 columns on the right are more valuable to the pharmacy and to the national coordinators and to WHO GLASS. At the national levels, they don't care about 3 North and 5 South and those individual wards, but they do care if it's inpatient or outpatient or if it's ICU. So the 2 columns on the right are not required, but they do help you to get a better sense of inpatient and outpatient and ICU issues. Location type might be inpatient, outpatient, ICU, and emergency. Those are the 4 most common in the human sector. The animal sector, it would be like veterinary clinic, wild animal, zoo, farm animal, the environmental sector, food sector, market, restaurant, etc. So on the left is very specific. What was the true location? On the right, it's just a more general category suitable for analysis purposes. Not going to change anything. I did not finish all of them, but that's enough for now. I'll do one more, cardiology. Cardiology is part of the Department of Medicine, and that's probably going to be an inpatient. Okay, I say continue. I say, okay. I'm going to say begin conversion. To do this one more time, the code already exists, the file exists. Do you want to replace it? Yes. And now you can see 5 north is 5 north. That didn't change, but it has added on additional valuable information, that meta information. This is medicine and this is inpatient. The idea being is that medicine inpatient is going to be more useful to the pharmacy than 5 north. And then national level, even at the national level, people don't usually separate medicine and surgery, but they do want to separate inpatient from outpatient. And of course, WHO GLASS is interested in inpatient, outpatient. And FAO is interested in pharm versus other kinds of categories. Isolate 1 looks good. Isolate 2 looks good. Isolate 3, surgery, inpatient. Next. Number of isolates, 28. Continue. Do you want to review the new codes? Yes. This list is getting shorter and shorter. I did not define all the locations. I don't have the time. I'm not going to define all of them right now, but you get the sense. I'm going to click on continue. Going to convert one final time to show you next. I've been ignoring this other option here called view database. I've always been clicking on continue. That only took 4 seconds because I didn't talk at all. When I click on view database, you can actually see the data. You see here the organism, Staph aureus, you see the specimen type, you see the antibiotic results. So in short, what have we done? What you were looking at, I showed you at the beginning of the demo, the Vitek data in Excel with Vitek structure, Vitek field names, and Vitek codes. Now you see the exact same data content, but with WHONET field names and WHONET codes. In fact, sometimes you see both. For example, here, Vitek calls it Staph hominis, WHONET calls it SHO. Vitek calls it Esch coli, WHONET calls it ECO. Same thing for sputum sample. Urine becomes UR, blood becomes BL. Sputum sample, BacLink did not understand until I defined it, became SP, which is sputum. If I go to the location area, so here ICU for North Oncology, I did not define those, so the department and location columns are empty. I did define 5 North as medicine. I did define cardiology as inpatient. So that's additional and valuable information that you know in your head, but it was not in the file. Now it's in the file, and therefore it can be analyzed. I'm going to click on here, close. Do you want to review the new codes? No, I've already done that. Okay, good. All right. I'm going to leave BacLink, and now how do I get started with WHONET? I go to WHONET, start WHONET, and my Vitek is not here on the screen. And I could click New Laboratory and begin from the scratch, to start from the beginning, but there's a shortcut. I'm going to click on Cancel. The shortcut is not on the screen. I want my BacLink demo to appear on that screen for my Vitek data. File. Create a lab from a data file. That's a very valuable feature. Sometimes people send me data, but they don't send the WHONET configuration. So I can use this feature, create a laboratory from a data file. In this case, nobody sent it to me. It's a file that BacLink just created. So I'm going to do create a lab from a data file. And BacLink is asking, WHONET is asking, what country is it? Let me put Ethiopia. Let me call it BacLink demo. I should have said Vitek. I forgot to put Vitek earlier. And let me give it the same code, BLD. I can say human or human animal food environment. And I can say data files. And this is that new file I just created. So these are Vitek data, but they're not in Vitek structure. In fact, I'm going to look at all files. This is the original data file. This is the data file that came out of the Vitek. If I tell WHONET to analyze it, WHONET say, this is not a WHONET file. I know it's Vitek data. Well, WHONET says, I don't know what it is. WHONET simply says, I do not understand this file. But BacLink, but WHONET does understand this file, which is the same information, but with the WHONET structure and the WHONET codes and the WHONET logic. You say, okay. I'm going to say OK here. It's asking me if I want to create drop-down lists. I don't have to create drop-down lists, but I like drop-down lists. So yes, I want to create drop-down lists. OK. I went to finish, and it's finished. Do you want to review the new configuration now? Yes, I do. This is the normal WHONET screen for laboratory configuration. I click on antibiotics. And here on the right, I did not type these manually. These are the Vitek antibiotics that were in that file. WHONET was smart enough to figure out what antibiotics were in that Vitek file. So this is a list generated by the file. If the lab tested imipenem, I'd see imipenem here. If the lab tested Vitek panels with meropenem, I'd see meropenem here. I'm going to click on OK. Locations. These are the different locations that it found in the data file. OK. Data fields. These are the WHONET data fields, including these special Vitek fields. I can go to data entry, open. I can find my Ethiopia Vitek file, view database. So now you can see we started with the Vitek file in Excel, and now we see a Vitek data in WHONET, and this can be analyzed just like any other WHONET file. Continue. So that's backlink with something very simple like Vitek. I'm going to go back again to backlink, and this time I'm going to do the Excel file. I'm going to do new format. I'm going to say Ethiopia, backlink demonstration, Excel, and let me call this BLDX just to give it a different code. File structure. Last time I chose Vitek, and I was finished. Same thing, SILAB. If I go to SILAB, I'm finished. I'll just show you a little bit of SILAB data fields, and they call it age, we call it age. They call it sampling point, we call it location. They call it original material, we call it specimen type. They call it organism, we call it organism. You don't have to do that. Backlink understood that already. We've collaborated very closely with IZS. The second example I want to show you is with Excel. So I go to the top, I say Excel, and here you see the dreaded no answer. It means I need to answer some more questions. Enter information in your data file. So I click on antibiotics, and now I have a lot of questions that were previously hidden. Question number 1, does your file have antibiotic results? I'm going to say no. Easy, no more questions. And you might wonder why WHONET would be interested in something without any antibiotic results. But keep in mind, people can use WHONET for malaria and fungi and anaerobes, for viruses, for COVID. You can use it for other things because WHONET is not only analysis of resistance, it does other analyses like trends over time, outbreak detection. However, my example for you today, yes, the Excel file I showed you does have antibiotic results. I can choose between CLSI, UCAST, multiple. I'll say CLSI. The antibiotics from one isolate in Excel, it was one row. All of those antibiotics, it was 3, I forget, ampicillin, ciprofloxacin, trimethoprim sulfa. They're all on the same row. That file I showed you was only disk diffusion. You only saw their zone diameters. If you have disk and MIC and e-test, there are going to be more questions. I won't show that now. Like, for example, the SILAB file, the Vitek was only MIC, the Excel was only disk, but the SILAB file would be disk, MIC, and e-test. So let's see. The Excel is one row, fixed sequence. And Vitek would be the same, one row, fixed sequence. The SILAB is more than one row. There's one row for each antibiotic. But if an organism has 10 antibiotics, that would be 10 rows. And they're in a variable sequence. It's not always ampicillin followed by cipro. It depends on the organism. So these would be the correct answers for SILAB, but for the Excel file I showed you, it's one row fixed sequence. I say, okay. Does the first row of the data file have a heading, or the columns labeled. Practically every system in the world, there is a heading there telling you which column is which, except for Sensititer. Sensititer, it's simply, it's in order, field 1, field 2, field 3. But most of the time, the answer is yes, there is a heading. Data fields. And here, BacLink says, I don't know, thank you for telling me you have Excel, but I need more information. On the left are the WHONET fields. On the right, let me put the Excel demo that I showed you earlier in Excel. WHONET calls it identification number. The Excel calls it medical record number. WHONET calls it location. The Excel file calls it ward. WHONET calls it date of birth. That Excel file calls it birth date. Specimen number is accession number. What am I doing here? I'm going a little too fast. I'm double clicking on it. I can either double click on it now, or I can use that equals. So that just puts the two of them equals. Specimen type on the left, sample type on the right equals, and now you can see they've been equated. Organism, microorganism equals. And I think that's everything except for the antibiotics. At the bottom, oops. I have to uncheck here. No disk, it's only disk, okay. Well, actually that's valuable for you to see. Here, because I said disk MIC and e-test, it asked me what column tells me the method. Okay, so these questions depend on your answers to the antibiotic questions. But if I say that all of the data are disk diffusion as a fixed value, then it doesn't ask me that question. Okay, let me select a sample data file again. Let me choose the Excel. And BacLink says, well, antibiotic 1 is ampicillin equals. But how many antibiotics are there? There are 3, so I have to click add twice. Antibiotic 1 is ampicillin, 2 is that, and 3 is that. Almost there. BacLink is saying, well, I know that the name of the column is ampicillin, but I don't know what antibiotic that is. It's undefined. So I click on define. And BacLink is trying to be helpful. Ampicillin, is that the same as ampicillin sulbactam? Obviously, no. Is it the same as ampicillin, but which ampicillin? There's 10 micrograms, 2 micrograms, 25 micrograms. So the CLSI and UCAST, CLSI always, and UCAST usually uses the 10 microgram disc. And I say, okay. Ciprofloxacin, I can double click on that, or I can click on define. Cipro, which Cipro is it? It's the 5 microgram CLSI one, okay. Number 3, define code. BacLink is being helpful. It's the first one. Sometimes people tell me, John, WHONET is missing some drugs. And I say, no, it isn't. For anything official from CLSI or UCAST, it's in WHONET. And if you're doing some experimental stuff, that's different. But every official CLSI drug and UCAST drug are in WHONET. And sometimes people say, John, you don't have cotrimoxazole. Well, I do have cotrimoxazole, but we don't call it that. We call it trimethoprim sulfa. Or let's say, John, there's no augmentin. I say, well, we do have augmentin, but we don't call it that. That's a brand name. We call it by the generic name amoxicillin clavulanic acid. So all of the official drugs with valid breakpoints should be here. If you can find something, then let us know. Then I say, okay. I've defined everything. Everything on the right now matches to something on the left. That doesn't have to be the case. If there are things on the right, like phone number, if you want it, great. If you don't want it, you can leave it out. You just match the things that are of interest to you. I'm going to click on OK. I'm going to click on OK. I'm going to click on Save. And I'm going to click on Save. And that's done. So now I have my BacLink demonstration. Let me just put the word reminder. I have my Excel import and my Vitek import. What I did for Vitek was very simple. I simply went and I said a Vitek and I was done. For Excel, I had to answer more questions. Not everybody, whenever you have Excel, all I know is that everyone's going to do it differently. So I had to answer these antibiotic questions that I did not have to do with Vitek. Data fields, I had to say this equals this, this equals this, this equals this. I did not have to do that with SILAB or Vitek or SensiTiter because BacLink already knows that information. Okay. Okay. Save, exit. Now I'm going to say browse to find my original file, and that is my Excel file. BacLink is suggesting a new name, Ethiopia BLDX Excel demo. Begin conversion. Record number 1 looks pretty good. The date of birth. Small problem here, I forgot to do the specimen date. I forgot to map it. Okay, so that's why I'm looking at the first 3. If I see specimen missing, or if I see organism equals John Smith, it'll show up here as a mistake. And I have my 3 antibiotics. Isolate 1, isolate 2, isolate 3. Next, it's a very small file. It's finished. Continue. Oh, no, continue. BacLink did not understand all of the codes in your file. Do you want to review the new codes? No, I don't, because I wanted the specimen date I forgot to capture. Go to Excel, edit format, file structure, data fields. And these are my mappings. Select a sample data file, Excel demo, and specimen date. I didn't match to anything. That's collection date, and that's equals. You can also see that BacLink thinks it's going to be day, month, year. Is that correct? In fact, it is correct, 22/12/2005. So if it's not day, month, year, you just need to go and you just need to choose the correct format, like we did for the Vitek. While I am here, I'm going to jump ahead because of the time to show you some more advanced. Modify the list of data fields. This is a list of fields that we give to you. There's the human questions at the top. If you say animal, it'll give you animal questions at the bottom. And this is the list we give to you, but you can modify that list. For example, if I'm working with animals, I can just remove. I can add. So you can use this feature to remove things that you do not need or add things that you do want. For example, if I go to FAO InFarm, those are the 3 fields I mentioned: data year, data representativeness, and surveillance program. So you would just want to make sure you add those 3 fields. For example, if you're doing SensiTiter, you add in those 3 fields so that you can get ready for InFarm reporting. And you see animal species, animal type, production, market category. So the list is very configurable depending on your needs. Make the list as short as you want or as long as you need. I'm not going to make any changes right now. I'm going to say, okay. And then you can do like move up, move down. I'm going to say, okay. Okay, so the reason I came here is I came to fix the collection date. I did that. I can save, okay. I can save, okay. I can click save, okay. Exit. Let me convert it again. Begin conversion. Do you want to overwrite? Yes, I do. And now the data is there. Isolate 1 looks good. Next, isolate 2 looks good. Isolate 3 looks good. And then it finishes. Continue. There were 10 isolates. Do you want to review the new codes? Yes, I do. And here, it doesn't know any of the codes because it's an Excel file, and every Excel file is different. Let me start with the most important. Well, the antibiotics I did already. I don't have to do that here. I did it elsewhere. Organism, define codes. S. aureus, define code. Is that S. aureus? That's it. You see here Staphylococcus aureus and Staphylococcus aureus subspecies aureus. They have the same code, SAU. The second row, that is the official name. But we're busy people. Nobody says Staph aureus subspecies aureus. People just say Staph aureus. It doesn't matter for WHONET because it's called a synonym. They use the same code. So a different example. Multiphilia. There is an organism that was known as Pseudomonas multifila, and then it was known as Xanthomonas multifila, and then it was known as Stenotrophomonas multifila. That is the current name, but we never changed the code. The code is PMA. That makes it easy for us to deal with nomenclature changes. We change the name, we retain the old names, but we keep the code unchanged. But this is Steph Aureus. If it is an MRSA, because sometimes people don't call it Steph Aureus, sometimes they call it MRSA. If you call it MRSA, it's still a Steph Aureus, but you can call it MRSA positive. I won't do that for this one because I don't know. I'm going to say okay. Oops. Okay. Well, I wasn't happy with something I did. Okay, Klebsiella pneumonia. Klebsiella pneumonia, subspecies pneumonia, or Klebsiella pneumonia, they both have the same code KPN. E. coli, there's Entamoeba coli, which is a parasite, but no, it's E. coli. Pseudomonas aeruginosa, that's fine. CNS. Backlink says, I have no idea what that is. I know what that is. It's coagulase negative staph. Coagulase negative staph. C. albicans is Candida albicans. Viridin strep is Streptococcus viridins. GC is Neisseria gonorrhea. You just type part of the genus and part of the species, okay? And Staph aureus is Staph aureus. Specimen type. I'll only do a little bit because we already did this for the Vitek. BAL. We don't have BAL. We have bronchoalveolar lavage. WHONET does not have surgical wound. WHONET has wound surgical. That's a good match. Urine Foley is what they call it. WHONET calls it urine from catheter. CSF, I have to search for it, is cerebrospinal fluid. Okay, continue. Okay, I'm going to convert again. This time it's going to know the codes. Excuse me. Blood is blood. Well, these ones it already knew. That one is fine, continues to be fine. Next. That was the same as the Vitek, no difference. It now understands everything except for the locations. And the same idea with the Vitek. Ortho is surgery, medicine is medicine, diabetes clinic is diabetes clinic. Won't bother doing that right now. Yes, next. And this time I'm going to click on View Database. So I showed you 10 isolates in Excel. Here are the exact same 10 isolates, but in the WHONET structure with the WHONET code. So that's all Backlink is doing, is basically taking information that your system understands and making new files with the same information, but in a language that Backlink understands. Review the new codes. No, I don't want to continue. I'm going to go to WHONET and again show you that shortcut, WHONET. The shortcut is not on the main screen. I click on Cancel, File, Create a lab from a data file. Let me call this Ethiopia. Call this Backlink Demo Demonstration Cell, BLDX, Human or Human Animal Food. Data files. Here is the Excel Demo SQLite file. I didn't talk about SQLite much. All of you know that DOC or DOCX is a Word document. PPTX is PowerPoint. XLSX is Excel. SQLite is SQLite. For standard. It's pronounced SQLite or SQLite. Either is fine. Even though maybe you've never heard of SQLite, according to Wikipedia, well, according to the developers, SQLite is the most widely database engine in the world, but you never hear about it because it's used on like cell phones. So SQLite, even if you haven't heard of it, it's extremely commonly used. There is a nice software. Unfortunately, Microsoft Access and Excel do not understand SQLite, but there is a software called DB Browser. It's the first option here, DB Browser for SQLite. It's a software very similar to Access. So and I click on download. So if you want to open WHONET files with WHONET, great. WHONET has no trouble with that. If you want to open SQLite files with Excel or Access, you cannot do it easily. There is a way, but it's not an easy way, involving something called an ODBC connection. But this is an easier way. The software was specifically made to look at SQLite files. That's all I have to say about that. And okay, so here's my Excel demo that BacLink just made. I say, okay. I can choose one file. I can choose 50 files. If this feature I'm showing you called Create a Lab from a data file has a number of uses. One is with BacLink to get started. That's what I'm doing now. Another, if somebody sends me a data file, but they didn't send me their configuration file, I use this. Another is a national data manager. They would like a configuration for the country. So what I will do in that case is I will choose all of the data from all of the labs to make a national configuration. Anyway, that's not BacLink, but let me just do since we're talking about BacLink, let me just choose this one file. Say okay. I say okay. Do I want to create a set of drop-down lists? Yes, I do. Do I want to look at the results? Yes. Antibiotics. And here I see the 3 antibiotics that I showed you in Excel earlier. Locations. You see the locations that are simply copied over from the data file. Normally I would like to show, I'll just show you one example. I'm going to go to File, Open Laboratory. Let me choose the Vitek one. Data analysis, percent resistance, E. coli, my Vitek data. So I was not able to do this with the Vitek file. I can now do it with the Vitek data in the WHONET format. And I can see my zone dam, I can see my MIC distributions. It's only 2 isolates, don't expect anything dramatic. It's a small file, but you know, my percent resistant, my percent susceptible. Just to show you that once the data are in WHONET, WHONET doesn't care whether the data were entered manually or via BacLink. Can you exit file, exit? Okay, I'm gonna stop sharing my screen. And if you cannot stay on the call because we have gone over, feel free to drop off. The recording will be online maybe by the end of today, along with the PowerPoints, but I'm happy to answer questions. Adam, any questions?
Yes. How about right at 8 o'clock?
Okay, BacLink is used to transform your data. Oh, well, okay, well, that was your answer, okay. Oh, Kaya, nice to see you from Turkey, good friend. Does BacLink work as an add-on program and get the data automatically from the program we use in the lab? It doesn't, it's not integrated. So with your system in the lab, you go to the system in the lab. We do not have an API live connection. So you go to your LIS and you ask them to please export a text file or an Excel file. They could do it manually once a month. They could schedule it automatically every day or every week. So it's 2 steps. Step 1 is your LIS creates a text file or an Excel file or an Access file, something that BacLink understands. And then step 2, you run BacLink. So, I mean, in a general sense, it's kind of an add-on. These are 2 separate systems. You have your LIS and you have BacLink WHONET. So it's adding on in that sense, but they're not talking to each other. Step 1, you export. Step 2, you import. Okay. Adam, the next question.
I think it's 802.
802, okay. If we analyze retrospective data in the latest WHONET, will the interpretations change? There's the CLSI, as long as I'm talking about but I already showed you the documentation. There is a CLSI document called the M39, and I'm one of the co-authors of that. And that's about analysis and interpretation of human health data. There's a similar document called the VET05, which is a very similar document, but it's for food of, samples of animal origin. And the recommendation is if you analyze old data, you should use today's breakpoints. So if you did an analysis of 2010 data in 2010, and you repeat the analysis today, you're going to get different percentages, and that's not a mistake. The reason we recommend the new breakpoints is that the method hasn't changed. It's still the same method. If you repeat the test, the MIC value should be the same. But the new breakpoints reflect a better understanding of resistance. A very important example in the year 2010, where CLSI and UCAS strongly disagreed on where the breakpoint should be for imipenem and other carbapenems, and also the third generation cephalosporins. And CLSI said that if the MIC is 4, it's susceptible. And UCAS said, no, 4 should be resistant. And they were not talking about mechanisms of resistance, is there a gene or not? They're talking about expected clinical outcome, pharmacokinetics, pharmacodynamics. Because if a bacteria is a little bit resistant, you can often still treat the person or the animal safely. That's the difference between clinical breakpoints, where you're trying to give guidance as to what antibiotics will work, even if there's a low degree of resistance, versus ECOFs, epidemiological cutoff values, or ECVs, where you're trying to find phenotypic evidence of resistance. So CLSI and UCAS disagreed. And then CLSI realized they were wrong. I'm kind of guessing there were treatment failures. I'm kind of guessing there were confirmed mechanisms of resistance. So the new breakpoints are considered more accurate than the older breakpoints. They don't change the breakpoints wildly, but when they change the breakpoints, it's for an important reason. So the new breakpoint should be used for the old data. If the statistics don't match, that's because the new statistics are considered more reliable and more accurate. Okay. Hello, thank you for the interest in, please come to here. And I have been to the Princess Marina Hospital, as well as the National Reference Lab across the street. I believe you were using Meditech at the time with support from South Africa. I would love to come back to Botswana sometime. Just ask WHO or somebody to send me. I do remember the wonderful set of books written by a Scotsman, the #1 ladies detective agency, in Botswana. So I'd love to get back at some point. Okay, good. Greetings from Nigeria. I have a question. How is it possible to connect WHOMAR directly to an EMR or Access database using an API so the patient's information can be captured directly? It's not something we standardly support. I suggest you write us an email and we can discuss what would make most sense. It's a question is, if you're trying to get the data from the EMR, electronic medical record, into WHONET, and we could see potentially a value for that if we could work on it, the logistics of it, the technology. If you're interested in getting WHONET information from WHONET into the LIS, that's much more complicated because we're sending information into your LIS. And obviously there's security issues there. And also all of your LISs are different. We can't make an API for 50 different systems. So there is a resource issue for us to consider. So I would say it's something that we try to avoid, because if WHONET's not working, we don't provide 24/7, service. We cannot do that when our focus is surveillance or resistance. So you maybe write us an email with your specific needs, and we can maybe give a more specific response. Okay, in case of emails, email contacts. So Adam, is that the last question? No, let's see. I'll just say it right now. Generally, help@whonet.org. I will repeat that, help@whonet.org. I'll also show you the WHONET website just so you can see where to find these resources. At the end, can we get a link? I'll show you the link right now. After we click on Start Conversion, when it shows us mapping results, are we obliged to click on Next until it only shows you the first 3? So click Next, 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 and then the rest it will do on its own. If you have a database with 1,000 isolates, no, you don't do Next, 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 Next. You do Next 3 times.
On the WHONET main webpage, we have a few links here at the top. So the one relevant for this is the webinars link. So later today, we will post the recording of this webinar. So you'll have the video recording as well as the PowerPoint slides. We'll have something similar up here where there's just a link to join the meeting now.
Can you also please show the training center? Maybe you did already, I'm not certain.
Nope, not yet. Okay, so the other link at the top here is the training center. So this houses all of our documentation.
Right, so you see the WHONET training course, and then in the relative near future, you will also see a backlink full training course, including links to this webinar. You also see somewhere there the automation tools. You see you see 2 documents about InFarm. There's one document, I believe, Inform and backlink, a different document, Inform and WHONET. So it's a lot of valuable information here. And Adam, can you go to the contact screen? So you see help@whonet.org. Okay. Okay, Adam, other questions to address, to get to? Well, I see from Tromsø. I've been to Tromsø a number of times, working with Gunnar Skov Simonsen, who spent a year with us here in Boston. Made 2 trips to Svalbard, above the Arctic Circle. Okay, we've set up nightly scheduled job imports here, but we've had some errors in the summer with the scheduler crashing on step 2 in the automation. So it'd be good to know whether it's the WHONET Automation Tool, in which case we can help you. There's also some people use the Windows Task Scheduler. We have found personally the Windows Task Scheduler to be a bit unreliable. It works, and then after a few weeks, a few months, it stops working. So is there any way we can capture detailed error logs in the automation? I think in principle, yes, but I suggest you send us an email. If it's an issue with the WHONET Automation Tool, 2 things. One is we want to address it and understand it. And secondly, we can think about this issue about error logging as you're describing there. And greetings to Gunnar. I see Nelson from Rwanda. We chatted with Rwanda earlier in this year. I've been there twice. And I wrote for an update a month ago, and they said, oh, everything's working fine. We're doing WHONET, we're doing backlink, we're doing glass reporting. So I was very impressed by the accomplishments in Rwanda. And Belen, friend from Madrid, that I know through the EarsNet project. Adam, I think there are no additional questions. Just scroll up a little bit.
There may be one there, 918.
Yes, I see that. Is there a way to extract data from WHONET with the integration side by side the AST result like it was for Inform without using the Inform formats? I'm not quite sure I understand. Is there a way to extract data from WHONET with the integration side by side the AST like it was for Inform without using the Inform formats? I'm kind of thinking yes.
The interpretation and the measurement, is that the question?
Right. We have also made, we have made, Adam, we meaning Adam, we've made an Inform AST interpretation tool. If somebody has an Inform file that they made without using WHONET, if they make an Inform file with the measurements, we can populate the interpretations. Or if they've already populated the interpretations, we can compare it with our interpretations to see if the interpretations don't match. Either they're correct or we're correct or neither are correct, or sometimes there is some ambiguity and it's a question of opinion. So I think the answer is yes, but I suggest sending us an email just so we can better understand your need. Yes, and I see again from Gunnar in Norway. Gunnar was describing a very impressive project to try to take nationwide SAT-scan, WHONET SAT-scan. We've done 2 webinars about SAT-scan, which is space and time scan analysis, for automated outbreak detection. We've used it mostly for hospital outbreak detection, but you can also use it for community. So we're very happy to support that Norway project. Can we have the user script for WHONET? The user, I don't know if you mean the source code, right? I'll comment on source code. WHONET has always been a free software, but we have not made the software. The software is freely available, but we have not made the source code open source. We're trying to do that now. We need to clear with the hospital and the lawyers, the contracts. Question is, who owns WHONET? The answer is the hospital owns WHONET because they coordinated it. But if we were funded by the CDC and WHO and FAO, we need to make sure that we are permitted to do so. We think it's a way, we think we can do it, but we need to get legal clearance on that. But if user script, if you meant something else, I don't know what you would mean by user script. If there are no more questions, I'm just going to stay quiet for a little bit and wait for more questions. And people, you can feel free to start dropping off. Feel free to write to us by email anytime. We're also looking for collaborations. If people are interested in grant applications, we're very happy to explore possibilities for doing that. Oh, South Sudan. I was there finally last year in Juba visiting the animal health laboratory. And I was again in Ethiopia. The people from South Sudan were also there. Comment from India, Dr. Jyoti. We've been using WHONET and BacLink in our state, Mahasar. Yes, I've been supporting that a lot. I think I gave one training to Mahasar Net, and that was through Dr. Anuj Sharma from the WHO country office. Thank you for the comment. It is great. It's always nice to hear that. As I said, sometimes people tell me, John, WHONET is so wonderful, and they use it once a year. I said, oh, great. You've done all that work, and you get benefit once a year. So if you're one of those annual users of WHONET for antibiograms and GLASS and Inform, think about the additional WHONET analysis options for weekly, monthly, quarterly reporting to your different pharmacists, infection control groups. And you can go through our other webinars. This is the first webinar where we focused on BacLink. All of the other webinars have been about data analysis, reporting, interpretation. Oh, okay, that's very good news for us for Bhutan. They developed this IT system called EPIS, and for a very long time, they did a really nice job. We had a nice collaboration on the AST module, but they couldn't get the data out. And they had to go back to re-enter data into WHONET to do some statistics. But the comment is here, we could extract Excel data from EPIS, and we try to analyze it with WHONET. So that's a very nice advance. People in Bhutan, my sister's going to Bhutan in 2 weeks. There's a Global Happiness Congress in Paro. So if anyone's in Paro, my sister will be there for about a week. For Colombia, thanks from Colombia, we're having a WHONET webinar with Colombia for an hour and a half, October 30th, I think, at 10 a.m. my time. In Colombia, many labs are using WHONET 5.6, which is quite old. It works, but it doesn't have any of the new features. So one of our goals is to help people migrate over to the newer versions. In Colombia, I think it's the only country in the world where it is required by the Ministry of Health for hospitals above a certain size to use WHONET. It's over 400 laboratories, I understand, so a very impressive accomplishment. So the suggestion for a new feature that will easily show alerted specimens from the database view, and if similar features do exist, let me know. Thanks for the wonderful work from Nigeria. Well, when WHONET, from database view and data entry, WHONET doesn't show the alerts. But if you do data analysis, there's an analysis in WHONET called microbiology alerts. When you run that analysis, all of the red alerts show up in red. So I think what you were describing, WHONET does offer, not in the data entry program, and I've never thought about putting it there, but it is in the data analysis program. Go to analysis type, microbiology alerts. By default, you get the medium and high priority alerts, quality control, and important resistance, and important species, and you can configure it in certain thresholds. So I think what you're describing, WHONET does do, but it's an analysis feature, not a data entry feature. People from Bhutan, right over there, right behind my chair over there, I have two Go, the traditional Bhutanese male dress. It's an honor, a privilege. Thank you for the assistance with getting me something that fit. That was an appropriate style. Oh, I do see, can BacLink be used for food laboratories? Definitely. I showed that area where you can remove fields you don't need, first name, last name, date of birth. There are options on the left, veterinary, Inform, and you can add fields that you might want that are not there. And we do have a lot of food fields, category, brand, expiration date, I think we have in there. And if there's a field you want that you do not see in the predefined WHONET list, WHONET, BacLink and WHONET have an option called user defined. So yes, BacLink can certainly use for food laboratory data. We have less experience with that and even less experience with environmental samples. And that's how BacLink gets better and WHONET gets better. People try to use it. They say, John, it's good, but it could be better if you do these things. So the answer is yes, BacLink can be used for food data. And that is one of the Inform modules is food commodities. See another question here. We give our daily reports via WHONET. Can we have a way of indicating the aware classification? It's interesting you asked that. For people who don't know, the WHO aware, I forget the name of the book, is a categorization of drugs into three categories. A, access. WA, watch. RE, reserve. And in June, Adam added this to the WHONET data system. So if you do a % RIS, I mean, this may as well show it. It does not show up at the present time on the clinical report. Oh, I don't want to share my screen because I might drop out of the call accidentally. So WHONET, we actually, when you do a % RIS analysis, WHONET shows you % RIS. At the top, it says show hidden columns. If you click on show hidden columns, you do now see the aware classifications as well as the WHO CIA classifications or code. I forget who manages it now. I think maybe Codex. CIA are critically important antimicrobials. So that information does not appear in the clinical reports at the time for the time being, but it does show up in the analyses as a hidden field. We could think about putting into clinical report. I have seen clinical reports. The idea is stewardship. You don't want if you have an E. coli sensitive to ampicillin and imipenem, use the ampicillin. It's cheaper. If it's sensitive, imipenem is not better than ampicillin in strains that are ampicillin susceptible. So how do you prevent? Because a lot of doctors, if they see ampicillin sensitive, imipenem susceptible, many doctors will choose the imipenem because they've heard such wonderful things about it. How can you encourage them to use ampicillin? There are a few ways. One is don't tell them the imipenem. Oh, Adam, thank you for bringing that up. So Adam has run the % RS analysis. He has clicked on show hidden columns, and you see somewhere the column called WHO aware, access. Access means the drug should be relatively freely available. Watch means the same, but you should be more careful about it. And reserve is more like on permission only, get an ID consult. So the idea, so how do we get people to choose ampicillin instead of imipenem in bacteria that are ampicillin susceptible? One is to hide the imipenem result. It's called suppression reporting, selective reporting, cascade reporting. That's one way, is just don't tell them the imipenem result. Another way is put like dollar signs, $1 sign, $2 signs, $3 signs to indicate expense. But your idea is you could also say watch, as long as they understand the concepts. So these are all different strategies to deal with stewardship. Another way, of course, is it doesn't have to be on the clinical report, but the doctors know imipenem, vancomycin, amikacin can only be prescribed with an infectious disease consult. So these are different strategies for improving stewardship. Another thing is stop orders on day one. I have a patient with sepsis in the ICU. I'm going to use imipenem. That order will automatically stop after 3 days, and you need to reorder it because by that time, hopefully the microbiology results will be back. So these are different components of a stewardship system. So Adam, I think we're ready to close. Thank you all very much. We haven't decided the topic of the next webinar. We won't do it like holiday, Christmas week. We'll try to do it before that. If not, then January. We'll decide. But we haven't picked the topic yet. If you have suggestions, happy to think about that. We do plan to have a webinar focused on animal health, but I want FAO to take the lead on that. It doesn't make sense for us to do our presentation on animal health without. And what we did with WHO Glass is we did a co-presentation. WHO was on the course and myself. We could do something similar for animal health. So we'll ask them about timing when they would like to do something like that. In data analysis, when we choose by patient, the number of isolates reduces. How it works. If you guys, there's always this question about numbers of patients. And sometimes people say, John, the numbers don't add up. And I say, well, they're not supposed to add up. And it depends on the context. For example, if you have one person who has E. coli in January, February, March, April, May for 12 months, that's 12 isolates, but it's one person. So if you get a table, it'll say 1 for January, 1, 1, 1, 1, and then the total will be 1, which is correct because it's the same person. So I think that WHONET, if there's a mistake, we'd like to know, we'd like to fix it. If you could send us an example, the person who asked about the number of isolates, it shouldn't reduce, but I'm sure there's a simple explanation. If you send us an email, we can take a closer look and give you a more complete response.